Good afternoon, Janet.
Hello, how are you?
Great. I'm so excited that you're here. Thank you for joining Michelle's Conversations That Matter.
Absolutely, I'm excited.
Happy midweek to you. I'm so excited that you said yes to being here. I have been a fan of Caring Contact, the work that you do, and I adore you. I met you. I love how we met. We met through the program at Westfield High School called It's a Girl Thing. I was asked to speak. You were asked to speak. I was blown away by this program. I was blown away by the conversations that were happening. Yeah. And then I got to see you talking to them. It's just incredible. Can you take a second to introduce yourself to the audience?
Sure. So my name is Janet Sarkos. I'm the executive director of an organization called Caring Contact. It is a crisis hotline in North Central New Jersey where we answer 2 phone numbers, both in the same phone room and with the same people answering the phones. One is something that hopefully everybody's very familiar with, and that is the National Suicide Prevention Lifeline. So that's a network, a nationwide network. We answer 5 counties in New Jersey, and so different centers answer different areas. So we're the primary responder for one area in New Jersey. But then we also answer something that we call a warm line or a non-emergency hotline, where we're taking care of people who may not be in extreme, immediate distress, but just the widest ranging group of issues. It could be as simple as somebody who is lonely, or who is physically injured and isolated, or somebody who's grieving, a relationship breakup. I mean, it just really runs the gamut of all kinds of calls that might not be emergencies, but really important. So that's what we do at Caring Contact.
Amazing. So when we met when we met, It's a Girl Thing, I was there bearing my soul, telling my story about my mother and my memoir and my relationship to mental health and how that shaped me by having a loved one with a mental illness. So what is your connection to mental health, and why did you get engaged in Caring Contact?
I've always, also interestingly, I studied business in school. That's my background. But I always had this sort of just general feeling like of wanting to take care of people, be a caretaker. And then I had a family member who, has struggles with PTSD and really has struggled through some mental health issues. So really feeling it in my own house, in my own family life, and wanting to do something, but really not really knowing what to do. I guess I started just as a volunteer. I looked out across the landscape and thought, I want to help people. I want to be there for people. People are suffering and hurting. And I know I'm not like a clinician, but I want to do what I can. And I found Caring Contact that way as a volunteer. Trained, took a lot of training and became a listener on the hotline. And that's how I first got started here. And I love that because eventually I got to know the organization and people. I just did more volunteering just in the business side of things. And then when about 4 years ago, they were looking for a new executive director, they knew that I really just cared so deeply about the work. That's what drew me to the organization in the first place, but then that I had the business background and that I could come in and run the business side of it. So I just felt so lucky that I could do the job that I, was educated to do, but also just do it in a way where I could touch people's lives and help them and just be there for them. So I love it. And I'm still a volunteer. I still listen on the hotline. So it's
what does it mean to be a listener on the hotline of Caring Contact?
Ooh, that's a good question. You know what? We always talk about this amongst ourselves. We're not fixers. We're not a resource organization. We're not parents. We're not better than anybody. We're just regular, everyday people who show up and are trained to really listen. And I don't mean that lightly. I mean, really listen actively, empathetically, and most importantly, non-judgmentally. We're just we teach our volunteers to be genuine, like just be themselves. So you just come to the conversation and you open your heart and your ears to whatever anybody is dealing with, and you don't try to tell them what to do. We're not experts, we're just people.
Mm-hmm.
And so we show up and we really hear them and we connect to them and we make sure that they understand that we hear what they're saying. And it's amazing and unbelievable that when people, how many conversations I've had where someone has said, "You get it. Thank you."
Mm.
Everyone's trying to tell me what to do.
Yes.
So it's this beautiful little relationship. Every single conversation. It's awesome. It's really amazing.
The power of being heard.
Yeah. Yeah. And just we have this metaphor that we use of just sitting in the hole with somebody. You're just sitting next to them. And it's amazing how healing and helpful it can be to have somebody who cares and who's not judging you just sit next to you. You know, it's cool. Really cool.
So amazing.
Yeah.
Tell us more about Caring Contact. Give us sort of like the landscape. I know in the intro you sort of gave us a little bit, but like, what is it? It's a nonprofit. It's in Westfield. How many listeners do you have? Like, tell us more about Caring Contact. Get us familiar.
Yeah, very briefly, we're pretty small, actually. We're a very tiny staff. We are mostly just volunteers. Everybody who answers the hotline is a volunteer. Our board is a bunch of amazing volunteers. So we have this tiny little staff, a humble little office that I'm sitting in right now. And we have our phone room here in Westfield, but we cover 5 counties in New Jersey. So any calls that come in from the National Suicide Hotline from our service area come into our center. Mm-hmm. If we can answer it, we do. If we can't answer it, we have other centers that back us up. It's a whole network of centers. Mm-hmm. But that really is our work, and our mission is to answer the hotline and to make sure that people are really, really well trained. We take that so seriously. Not only do we have our 72 hours of training to get people ready to be on the hotline, but then constantly doing advanced training, special topics all along the way. So once you become a listener, it's so much all about the training. And that's what we do. It's pretty simple. We are a nonprofit. We get no funding from local, state, or federal sources. So a big part of our job is to make sure that we have funding that comes in, and we have a lot of we have a lot of really great donors, both mm-hmm. individuals, businesses, foundations, who help us out and make sure that we can run our operation. And we're 45 years old, so we've been managing to do that for a long time. Yeah.
That's amazing. I grew up in Westfield and I never even knew about Caring Contact. And yet it's a girl thing, and you're handing out cards where these young men and women, well, in this case, mostly all women at this program, they had a hotline that they could call. Like, I thought that's amazing to have our youth prepared to be able to help themselves or each other.
Yeah. So that's a big part of the work too, is just having people know about us. I mean, I think before I got involved with hotlines, I have to admit that I thought they were kind of weird. Like, that's for other people to call. I would never do that. I don't like people who are really in bad shape or who don't know anybody. They're the ones who call. And obviously, I've changed my thinking all the way around, because I see that all kinds of people call us. Every demographic that we could sit here and discuss, from young to old, every ethnicity, every religion, it's amazing. We get all kinds of callers and people who have other people in their lives. So it isn't that you're, like somebody who just has nobody and nothing. Most of the time, it's just people like you and I, and somebody who needs something a little bit different and a little bit special to make a connection. Maybe it's to not be judged. Maybe it's to make sure that they can really let it all out and know that it's private.
Yeah.
And that it's not going to affect their family life, their job, their whatever the thing is in their lives. You can really open up and be real. and have somebody hear what you have to say and sort of talk through something with you if you'd like that, and know that you can just kind of get it out in a really safe place and move on with your life. It's just, most people are that.
I love that. I love that so much. One of the things I always try to remind people to do if they're struggling is to not stay in their head, to find someone to talk to articulate how they're feeling. And I love this hotline. And so talk about the anonymity, because there is that hesitation. I'm going to call, someone's going to find out, I'm going to be judged. Where is this, if someone wants to, can they find out that I had a moment and had to call? Like, what's that?
Thank you for bringing that up. It's so important. What we say, and I mean, what we do is that every conversation stays here within our four walls. Like, it's not going to go outside of this organization. So conversations are private and they're protected. The one exception to that is, and we say this very openly, if somebody is in danger of, in the moment, killing themselves or hurting somebody else, we will help them get help. And let me say a few things about this. Number one, we always try to collaborate with the person and have their consent. And we usually are successful with that. People call us for help. And so, we stay calm. These are long conversations when someone is really in that intense situation. And almost always, if we have to make those calls to emergency services, it's a collaboration with the caller. Very, very rarely. And I want to give you a statistic so you really understand what I mean. Last year, we took about, I don't want to get these numbers wrong, but we took about 11,000 calls last year, almost 11,000 calls. And we called out to emergency services 53 times. So almost always we keep it close, because people call us because they want help. And so much of the time, the help that they need is just the conversation and the time and the care. They don't need hands-on help.
Right.
We will do that for them if they want it. Always, if they want it, we will do it. And sometimes we have to judge that they need it.
Right.
But it's so rare because, our listeners are really well trained to work with people and make sure that, they're calling the place that's going to give them the help, and the help that they're going to get is that time and that care and that conversation. Hopefully, that well.
Yeah, no, that's very helpful. What kind of people are listeners? What kind of people are you seeing that volunteer? Because that takes a generous heart. I mean, it takes a lot of I don't know, consistent generosity.
Yeah. So it's exactly what you're saying. So the cool thing is that when I talk about, again, with demographics, our listeners reflect the same demographics that of the people who call us. In other words, regular everyday people who have every kind of a job that you can imagine. It's not mental health professionals. It's regular everyday people who have all kinds of work. We have listeners who are 20, and we have listeners who are 80, and everything in between, maybe even a little older than 80. So we really have all kinds of people, and it's really about, are you willing to set all of your own stuff and assumptions and beliefs and all of that aside, like kind of set them next to you? Like, they're not going to go away. You're still yourself, but set them over here and really be there for the caller. Open your heart, open your mind. And, we work really hard to teach people how to be non-judgmental, because we all come into things with our own stuff, and it takes a lot of practice. Put your stuff to the side and be there for another person. And it's just this amazing training. Everybody has come out of it and said, this changed my life. And I know for me, it changed mine. So it's just a willingness to learn, a willingness to learn something really brand new, a different way of listening.
If someone is watching right now and they want to volunteer and be a listener, can they just contact the website that's at the ticker on the bottom, caringcontact.org?
Exactly. Go to the website. There's a training tab on the website, and you'll see, volunteer listener training, and you fill out an application.
Awesome.
So we have 2 training classes per year. We're about to start our fall training. So we'll be accepting applications. We're always accepting applications. Our next round of interviews will be in January for our spring class.
Amazing. Oh, so amazing. So as you know, September is Suicide Prevention Awareness Month. It's a great opportunity for us to be talking more about the prevention of suicide. And COVID has had such an impact on everyone. And I sort of reflect and say, maybe now we'll start to pay attention to well-being because more people will be affected by an imbalance. So the CDC says 1 in 3 are experiencing depression or anxiety during COVID. So what was that like? How has that been for Caring Contact with your listeners, and how has COVID sort of shown up in your call center?
It's so much, so many different ways, because it affected the staff, all of us who are just trying to work and run this organization. I saw, obviously we had listeners who couldn't come and do the work. And so it was really a difficult moment in March when we realized that it was all happening. But then what emerged out of that from amongst our volunteer population was this intense level of commitment by the volunteers that we have. I'm not surprised. I mean, this is who these are these people. They are unbelievable. But, people did so many more hours on the hotline if they were able to. We, as an organization, had to shift a lot of our operations and enable some remote listening capabilities that was really brand new for us. And our volunteers just stepped up, took the training to become remote listeners if they were able to do that and get the technology put together. So from that angle, like the volunteer angle, I get choked up when I think about them, because just the level of commitment and care and help that just got put out amongst our volunteers was amazing. Thank goodness, because the call volume was up. We started tracking COVID calls from, I think, March 17th. Maybe March 16th, something right around when it was all going down that week, where we were all like, what's going on? What's happening? It was just really coming around. And in the second part of March, April, May, about 35% of our callers mentioned COVID. So it may be that they had other things going on too, but what we saw across the board was that the health emergency was like laying over the top of all the things that everybody was already dealing with and just making it much, much worse. And we got a lot of calls. Also, interestingly, we saw a real uptick in calls from healthcare workers.
Wow.
Who were so stressed and overwhelmed. So it wasn't necessarily that they were thinking about suicide, but we had a nurse who called, who had to go in to her shift, and she just was so overwhelmed and needed to get her head right to go into her shift, and didn't think that she could burden her family with her fears. And she herself was like, I didn't sign up for this. I don't want to do this, but I'm about to go do it.
Right.
Calls like that, where, just all kinds of, sort of frontline workers calling us and just going through their own stuff and then tying their shoelaces and heading out the door.
Right.
So we saw a lot of that where we had not seen anything like that before. So very powerful and very emotional.
So good to hear that healthcare workers were reaching out, because my heart went out to them because of I have a friend in California who was a patient of COVID, and he told me the amazing healthcare workers, the fact that they had to wear multiple layers of clothing, they had to work around the clock. I mean, my heart goes out to the amount of hours and the work that they did do. So it's good to hear that they knew about Caring Contact to reach out.
Yeah.
So important.
Yeah, we were thrilled to be able to support them. Like, it's a little thing that we can do, you know, that's what we do. And that connection was made, was amazing. Yeah.
So you said before we came on the air, you were sharing with me that Caring Contact is for someone who might need someone to listen to them, but then it's also there for other people as well. Do you want to share a little bit about that?
Yeah, absolutely. So I think this is something most people don't realize. You know, one of the parts of my job that I think is really important is I go out into the community and I talk about how every single person can be part of this fight against suicide, and, you know, part of the army who is helping people with their mental health, helping others with their mental health. And people feel confused about that. Like, what's my role? What am I supposed to do? How am I supposed to know? And so in that role, I talk about, you know, really just consciously paying attention to other people, really kind of taking that on. And it takes a lot of courage. It's hard to do that job. But what I say to everybody, and I from the youngest students who I speak with, you know, that feeling inside of you, like that sort of like, something's a little wrong. You don't really know what's going on, but you have that little feeling inside. Pay attention to that. Don't blow it off. Pay attention to that little feeling. And at the very least, think about calling the hotline. A lot of people do this and saying, I've got this friend. My mom, I'm worried about her and I don't know what to do.
Mm-hmm.
That's a big part of what we do on the hotline, is that we will talk to people who are worried about other people, and we'll brainstorm about that with you. And, you know, we'll look at your very specific and personal situation, and we'll have a conversation about what the next steps may be. So really thank you for mentioning that. It's really important.
Gosh, that's so important, because I get it all the time. People say, well, what are the specific signs and symptoms? And they feel like they have to take on the clinician's role of diagnosis.
Right.
And really all they have to do is be courageous enough to really listen and to really be in tune with them. And they don't have to fix it. I think we all think we need to try to fix it if we're going to be there. But really,
get involved, right?
You don't have to. You don't have to fix it. How about just being there? And I love that there are so many people who are like, okay, I can Google signs and symptoms of whatever, or they can just call you and say, this is what I'm seeing.
Yeah.
What you guys doing?
I think most people, if you really just sit and think carefully about what signs and symptoms may be, again, even in schools with kids, and we ask them, you know, what kinds of feelings might people be having, or how might they be acting that might alert you to something that's going on, or what kinds of things might they say that would, kids raise their hands and they come up with we all know what some of the signs and symptoms. The one that I like to bring up that a lot of people don't realize is that when people are going through situations, they may be the most well-adjusted, kind of got it all together kind of person, but situations can happen to any of us that could knock us off of our feet. And so COVID is one of them.
Yeah.
But it could be any of the regular life situations: grief, divorce, failing a class, going through a relationship breakup. Situations can get somebody in a really dark and tough spot, and they need help. They need support. And so look at the people around you, pay attention to what's going on in their lives. And if you know that they're going through something, that's a signal that pay a little extra attention. Start putting then other pieces of the puzzle together. Like, have they been displaying some feelings that are like not typical, or are they dressing differently? Are they eating differently? Are they sleeping differently? All the different other signs and symptoms that most of us know. But it's good to just pay attention to those situations that are happening for people.
Yeah, that piece of staying connected, I think, is so important. I know it's easy to write someone off as they're always happy, they're always good, I don't need to worry about them. I got news for you. You got to worry about them. If you have your circle of people and you're not checking in on the ones that you really care about, like, we really need to do that, even though we might perceive someone as being strong, because like you said, a life event, something can come along and it can knock their footing. Yeah. And if you know what they're going through, you can help. You can,
And it can be as gentle as saying, hey, you know what? We haven't talked about the fact that, we last talked after your mom just died, and, how are you doing? I know it takes so long to get through all that. How are you? Mm-hmm. Just, you can say it and relate it to the situation. Like, we really haven't talked about this for a couple months. How are you doing? And some people might say, oh, I'm fine, and not want to go there. And that's fine.
Right.
Or they might, like, one of the things I can tell you from the hotline and from practicing this in my own world is people are usually relieved when you bring up the conversation. They might not bring it up themselves, but they're relieved.
Yeah.
Yeah.
That's great. I always say that don't underestimate the power of how are you doing?
Yeah.
Even if someone dismisses it or thinks it's just a pleasantry, if you are persistent with asking, how are you doing? They know you've planted seeds. They now know that you care, and that if they needed you, they would reach back out to you as well.
Yeah. And this is like much sort of further down the line, but that extends all the way to asking about suicide, by the way.
Yeah, talk to us about that.
Part of like such a longer discussion, but what we know and what we teach in our listeners and in our community training is that if you are worried that somebody is thinking about suicide, it's not only is it okay to ask, but it's a gift to ask, and you can ask in a really gentle way, but you want it to be direct and calm, and just say, I've noticed that, you're just not yourself right now. I'm seeing you're writing a lot of stuff online, and I'm just so worried about you. And, is suicide something you're thinking about? It's not only is it okay to do that, it's the most loving and caring thing you can do. And I know it's uncomfortable, and we have all kinds of trainings that help people get to that spot and to a level of comfort with it. But we've been talking about ask people how they are. That goes all the way up to, I'm really worried about you. Are you thinking about suicide? Because I hear you kind of talking about it, and I don't, I'm scared that you're in trouble, and I want to help you.
Yeah. So the false language around that is, if I mention the word suicide, I'm going to plant the seed, right? And that's
there's so much research that is absolutely not the case. Yeah. And I've asked hundreds of people that question. I'm pretty sure I can say that no one has ever been offended. And in fact, either they'll say, oh gosh, no. And it's just, they're kind of cool with it. Or they'll say yes. And then that'll open up a conversation. There was this young man, he was early 20s, but he said when he was a teenager, he was going through stuff, and his mom asked him about suicide. And he's like, what? No, are you kidding me? But what he was saying to us as a 20-something-year-old was, I'll tell you right now, I knew that since my mom asked me that time, she could handle it. She'd be able to hear if I ever, the worst thing I could possibly be thinking, my mom was ready to handle that. Right. And I was just so touched by that, because that's what we're talking about. Like, if you can calmly have some of those difficult conversations, what you're doing is you're showing somebody that you are ready to hear the really hard answers.
Exactly. Yeah. Is there anything else that you would like to share about Caring Contact, about suicide prevention?
I think that one of my biggest messages is, don't be afraid to call the hotline if you feel like you need it, or you want to try it out, or you need a little advice about somebody else. It is me, and it's other people who are like me, who just are there to help you. We don't have a list of questions that we are required to ask. You do not have to give your name. And I always say to people, when you call, you know, we're all human beings. You may not love the person you're talking to. You might not have that connection with that person. You probably will. They're a lot of nice people, but you might not. If you don't, you get to just hang up the phone. So, and you don't even have to be polite about it. You know, you can just say, this isn't working for me. I'm going to go. Hang up.
Right. Mm-hmm.
You're done. And
right.
so I think my biggest message is give it a try if you feel like it might be helpful.
Right.
There's really nothing to lose, and there's an awful lot to gain.
Awesome.
Yeah.
Janet, I can't thank you and Caring Contact for all the great work that you're doing in our community and the lives that you've saved and the calls that you continue to have, and your volunteers are amazing. And thank you so much. Thank you so
welcome. Thanks for having me.
Yeah, thanks for being on Michelle's Conversations That Matter, and I look forward to staying connected to you. Thank you so much for being here.
You're welcome.
Awesome.